58-year-old lady has difficulty in using her hands. We're asking the students to examine her hands and they should assess the hand function. The findings are she has got a very tight skin here. She got some calcinosis. You can see very closely, if you look, she's got some telangiectasia. And can you roll? Yeah, there's a very nice spot of calcinosis here. And she also may have some telangiectasia here, and she has lost the pulp of the finger here. The hand function can be done by using the routine rheumatological examination, and also looking for things like trying to open one of the screw tops bottles. Can you open that for us, please? They're difficult. That's okay. That's okay. Again, when you look at her face, the skin is very tight. Again, she has some telangiectasia here. Are you open the mouth? Okay. Are you able to put 3 fingers in your mouth? How many can you put?
Sure.
Maybe 2. Okay, thank you. And she also has some tightening of the skin in the chest here. We won't be asking the students to take a history, but if they had to take a history, they should be asking for what happens to her hands when she goes out in the cold, looking for Raynaud's syndrome, difficulty in swallowing, and also asking history regarding pulmonary fibrosis. That will be a very excellent assessment if they do all those things.
Hi Judy.
Hello.
My name is Kylie.
Hi.
I'm aware you have some difficulty using your hands. Is it okay if I have a look at your hands today?
Certainly, yes.
Thank you. And could I have a look at your elbows as well?
Mm-hmm.
Thank you. And put your hands this way for
I
me.
can't get
please.
them all the way out.
That's okay. Thank you. And now I just want to have a feel of your wrists and your hand joints. Are you in any pain at the moment?
No, not at all.
Just flip your hands over.
Mm-hmm.
Can I get you to close your fingers for me?
That's as far as I can go.
Thank you. And this side.
Not very far.
Now I'm just going to move your hands and joints.
Mm-hmm.
Just try to relax for me.
Mm-hmm.
Thank you. And could you put your hands out in front of you like that and try to bend your wrists down as far as you can
That's as far as I can go.
and up,
Oh,
trying to keep your hands straight.
straight.
Yeah. Thank you. And could you move it side to side your hands. Okay. Like that.
Like that. Not much.
Okay, thank you. And could I get you to squeeze my finger
Mm-hmm.
as hard as you can? And put your hands in a fist if you can for me, please.
That's about as much as I can do.
And stretch your fingers out as much as you can, as straight as you can. And together. Thank you. And now I'll just get you to point your thumbs towards the ceiling like that, if you can. And don't let me push them down.
Alright.
And now push down towards my fingers. And push out if you can with your thumb. Thank you. And can you do this for me? Make a pincer grip.
Sort of. Yeah.
And try and hold the grip.
Okay.
Don't let me pull it through. And with your pinky as well. Your thumb and pinky.
No, can't do that one.
Okay. Are you able to flex your fingers at all? And this hand?
This hand's not so
Oh.
good.
Thank you. And could I get you to do this with your hand if you can?
No.
Or the other way? Okay. Thank you. And if I can, could I please get you to open this jar for me?
Mm-hmm. Sometimes I can, but
That's
it's a bit tight.
okay. Thank you.
Is there anything else you would like to do?
I'd like to have a look at the face.
Okay, and
skin.
then, yeah.
Could you open your mouth for me as wide as you can? Thank you. Just feeling for any thickening of the skin on the chest.
Okay, that's good. Would you
Thank
like
you.
to tell us what you think is wrong with this lady and your assessment of her hand function, please?
I think the lady has scleroderma,
Mm-hmm.
and the hands are very stiff with thickened skin and loss of movement in nearly all the joints, especially the DIP and PIP joints. Wrist movement is also reduced. From the inspection, I can see the skin is very thickened, and there are some areas of ulceration and calcinosis
Yes.
over some of the joints. She has some weakness as well, and she's got her facial skin is also affected,
Okay.
and her neck skin.
So what's the diagnosis then? Scleroderma or?
Perhaps systemic sclerosis.
So if you have time, would you ask her any more history? If you think she has scleroderma?
I would ask about Crest syndrome. So whether she has Raynaud's in her hands, esophageal problems.
Okay, that's good. Thank you.